What is a case study? The APA Dictionary defines case study as an in-depth investigation of a single individual, family, event, or other entity. Let's delete the last 5 words of that definition because that applies more to sociology, anthropology, or organizational studies. In psychology, especially clinical psychology, we're talking just about an in-depth investigation of a single individual, usually a patient. Case studies are focused on one individual. If you have more than one individual, it's not really a case study. It's probably a survey or an experiment. We'll talk about that a little bit later. Let's also focus on the term in-depth investigation. How to write a case report involves going into depth and providing important information. It has to be more than a vague reference or anecdote about someone you might know. The APA definition of case study goes further and says multiple types of data, psychological, physiological, biographical, environmental, are assembled, for example, to understand an individual's background, relationships, and behavior. In other words, a good case study tells us about the outcome, the criterion variable. That's usually the reason why we are doing the case study. It also gives us information about background factors, age and sex. And for adults, it would include information about family formation, education, and career. If there's any psychological assessment of the individual, that also would be important information. Any kind of recent triggering events and treatment, such as medication or psychotherapy. Let's give an example of a case study. Mr. J is a 76-year-old cisgender male. He was a carpenter, but he's been retired for 12 years. He grew up poor, experiencing some physical and verbal abuse from an alcoholic father. He married at age 22, had 2 kids, but divorced his first wife at age 35. He remarried at 38, maintained a long and successful marriage, but recently his wife died. He has good relationships with his kids, his stepkids, and his grandkids. His bereavement over the loss of his wife became a clinically relevant depression, as diagnosed by his general practice physician. Cognitive behavior therapy was prescribed, and Mr. J received 10 sessions with a licensed clinical social worker, after which his score on the geriatric depression scale improved. The APA Dictionary says one more important thing about case studies. These are limited in the extent to which their findings can be generalized. Let me explain that. Case studies prove nothing. If you go back to our example, you might think that it offers some proof about the cause of depression, or diagnosis, or treatment. Actually, it does not prove anything about etiology. It doesn't show that depression was caused by an alcoholic father, a divorce, a retirement, or even the recent loss of his wife. All of these things may have had some impact on his depression, but the case study does not prove how much of a factor each one of these was. Similarly, the case study does not prove that the diagnosis made by his physician was either reliable or valid. Probably was, but the case study doesn't prove that. Similarly, the case study does not prove that the psychotherapy he received was effective in alleviating his depressive symptoms. They probably were, but to establish that would require a different kind of research and experiment. So why do we bother to do case studies? Well, case studies help us illustrate complex dynamics of etiology. They illustrate how to perform a clinical assessment or intervention. And perhaps most important for researchers, case studies help us generate theories and hypotheses that might be tested in future research. We have to distinguish between case studies and other types of psychological research, such as introspection, where a researcher is studying himself or herself. The similarities between introspection and case studies are great. In both situations, we have a sample size of 1, and both forms of these research techniques really prove nothing on its own, but inspire us to do later research. Introspection is a study on yourself. Case study is a study you do on someone else. Both introspection and case studies involve a sample size of 1. If we have more than one person, and we are able to measure variables consistently in these different cases, that would be a survey. And if we're able to manipulate an independent variable, that would constitute an experiment. Introspection and case studies are qualitative forms of research. They provide rich data. Surveys and experiments are quantitative forms of research, providing precise data.